Inflammation decreases blood flow. All right. Inflammation causes agglutination. Agglutination is cells stick together more. The more cells stick together, platelets aggregate, you're going to have decreased blood flow, decreased perfusion, cold hands, cold feet, lack of energy. Blood flow is very important, and inflammation, whether it's refined, junky, processed omega-6 fatty acids, whether it's gluten, whether it's processed high fructose corn syrup junk food, all those things are going to have a major impact on the vascular side.
Yeah, it's all of it. Like everything we've already covered is really vascular. For example, the inflammatory on number one, the antimicrobial stuff, that the bugs, that could decrease vascular stuff. We know a lot of people with Lyme and co-infections have blood flow problems, brain problems, cold hands, cold feet. So it's really just the vascular is cool, but it's really all the same stuff we've already covered.
Exactly. Last one is type 6. This is going to be the trauma, right? This is the football injury. This is the car accident. This is the punch to the head, right? Traumatic things obviously impact the brain directly, not rocket science. So there's going to be inflammation from where that trauma is. And of course, it could be repetitive trauma like TCE, which is traumatic chronic encephalitis. This is what Dr. I think Palamalu, if you watch the movie Concussion with Will Smith, you can see that kind of documentary there. But he basically found these plaquing of the brain, and you can only test it post-mortem. So you have to be dead first, and then you do a brain autopsy, and then you see all this plaquing form that's consistent with TCE. Football players primarily have this. Anything that with repetitive head trauma, you could see it with car accidents. You can see it with, even in soccer too, taking a lot of headers. Anything that's chronic is going to be an issue. And then of course you have the acute stuff. Acute stuff could be car accident. It could be a big fall, slipping, falling, banging your head. Anything you want to add to that, Evan?
Yeah. So a lady named Melissa, her last name used to be Hartwig, but she got a divorce. Now her last name's Urban, I think, or maybe that's her original name. Anyway, she's the lady
she's the Whole30 girl.
Yeah, the Whole30 girl. So she actually had posted something about how she was at like a laser tag event and she doesn't know what happened, but I think she blacked out, and now she's been documenting all of her journeys and posting videos of her in therapy, like bouncing balls and stuff. So, she was just probably out with her kid having a fun day. And then I don't know what happened, if somebody hit her in the back of the head with a laser gun or what happened, but just one bang like that could be enough to just really throw everything off. And, when my daughter was 2 and she kicked herself back and her high chair toppled back and she hit her head on the floor and had a concussion, her gut was messed up for months.
I remember that. Yeah.
A lot of indigestion and burping and different things. So we know because of the gut-brain axis that a lot of people that have gut issues, just like you mentioned previously, you may not trace the gluten to the migraine. You're thinking gluten diarrhea or something. Same thing with head injuries. You may have diarrhea or you may have indigestion, and it could be from a head issue. So it's all connected is basically all I'm trying to say.
It's bidirectional. It's a 2-lane highway. So gut issues can create brain issues, but brain issues at that acute traumatic level can create gut issues. So it's really important, if you have a head issue, make sure you let your doctor know. Now, what do we do about it? So you can do natural anti-inflammatory things like curcumin or resveratrol or citrulline or alpha glycerylphosphocholene, high dose fish oil. Those are all helpful. Progesterone, fasting for a day or two can help. Those are all supplemental things. We can do laser therapy over the area to reduce inflammation. We can also do PEMF, pulsed electromagnetic frequency. We can do hyperbaric oxygen therapy as well. Hyperbarics are great. The increased oxygen can reduce a lot of the inflammation. Also, I'm a big fan of cranial sacral therapy from a chiropractor or a trained upledger massage therapist is great. Because what happens is there's cerebral spinal fluid that flows underneath the skull, right? These cranial bones. And this isn't just one bone. These are all interlocking, right? We have the parietal, we have the parietal, we have temporal, we have occipital, right? All these different cranial bones. And when they get stuck and don't move, the cerebral spinal fluid, the CSF underneath does not flow as well. And that cerebral spinal fluid really helps reduce the inflammation. It helps calm down the area of stress. So anytime you have trauma like that, you need to see a really good trained chiropractor or upledger cranial sacral therapists, they can make sure those bones are moving appropriately.
Yep. Great advice. I want to throw some more nutrients in there. You mentioned high dose fish oil, which is awesome. Progesterone being awesome. So I've done really well with the magnesium threonate, and I've used
Yep.
it hundreds of
Yep.
times because it crosses the
Flotation therapy
blood-brain
too.
barrier.
Mhm.
So like your magnesium citrate, your glycinate, and malate, we'll use those more for gut and muscle type things. But the threonate's great for, there's even some papers on PTSD, anxiety, cognitive issues, memory loss, and you can go much higher if it is more memory related. You can go higher with dosing of threonate.